Welcome to the Interprofessional Geriatric Education Program. I'm Maria Egger, a physician assistant practicing with Maine Medical Partners Geriatrics since 2014. I work at Cedars Nursing Facility and Fallbrook Woods Assisted Living Facility, providing post-acute care and primary care in the skilled nursing, long-term care, and assisted living setting. This upcoming talk will outline the special considerations for the care of older adults. The objectives are: discuss the potential physical, psychological, and socioeconomic changes experienced as adults grow older. List the 4 M's of the age-friendly health system and examine their interconnection. Carry out the concepts of the 4 M's through appropriate history-taking and evaluation of the older adult in order to achieve this level of care. And identify members of the interdisciplinary healthcare team who can appropriately address the 4 M's of the age-friendly health system. Let's get started. Growing older is a natural part of life. Through life experience, there is wisdom gained, priorities may change over time, and people's choices about their health will likely change. Nevertheless, the need for dignity, connection, and meaning is universal. It is your duty as a provider to preserve these things for your patients. When people approach the last part of their lives, the popular notion is that very little changes. However, the process of aging is not a stagnant time. We often think of rapid change during the early parts of life, such as early childhood or adolescence, but changes occur for older adults sometimes at a rapid pace. These changes can be physical, psychological, and socioeconomic. Those of us caring for older adults are now looking to the age-friendly health system. This consists of the 4 M's framework: what matters, medication, mentation, and mobility. These are the essential issues that should drive all decision-making for the health care of older adults. Focus should be on strengths and wellness rather solely on disease or deficits. The 4 M's are relevant regardless of the patient's disease burden and may apply regardless of functional status. And of course, they should apply regardless of a person's cultural, ethnic, or religious background. Addressing these issues is how we preserve dignity, connection, and meaning. Determining what the 4 M's mean to a specific patient requires taking a detailed history. Your manner should be warm and professional and not overly familiar. I address everyone by their surname until invited to do otherwise. Make sure that you are able to establish level eye contact with your patient. Avoid standing over someone when you speak to them, and speak directly to the patient even if there are family members in the room. I work in the inpatient setting, so I make sure the room is well lit and try to reduce extraneous noise. I ask the patient if it is okay if I turn off the television and close the door to reduce noise from the hallway. Allow time for the patient to answer your questions. Try not to answer for them or suggest answers. Observe the patient's body language. Sometimes a patient may deny a certain symptom, but their body language says otherwise. If you are in the patient's home, their surroundings can be very informative as to what is important to them. Look at personal belongings or photographs. You can also get an idea of how well they are functioning depending on the state of their household. If necessary, ask questions of family members if you need clarification after you have interviewed the patient. Now let's discuss the 4 M's in detail. At the top of the circle is what matters most. We want to align care with the patient's specific health outcome goals and care preferences. The other 3 M's should take into account what matters most. Ask the patient what matters most to them. Any medications, treatments, or other interventions should be aligned with the patient's goals regarding what matters. They may express that they want to remain as independent as possible, or a patient may tell you that they are nervous about living independently, anxious as they anticipate trouble taking care of themselves in the future, or are already struggling and may want to think about a higher level of care, such as assisted living. What matters also involves advanced care planning, including naming powers of attorney, filling out advanced directives, including a pulse. Going clockwise around the circle is medications. Medication should be tailored to meet patient goals and preferences, and high-risk medication should be avoided. We will go into the details of prescribing for older adults in the next talk, but briefly, medication review should be done at every visit to make sure that medications are safe and necessary, do not negatively affect the patient's functional or cognitive status, and align with what matters to your patient. For example, consider a patient who may have a very active social life and does not want to be bothered with taking medications in the middle of the day or in the evening. It may be appropriate to transition from a short-acting medication to a long-acting formulation so that the patient may not have to worry about taking medication during social activities. In addition, we want to make sure that medications are being taken appropriately. When you are taking a history, find out who manages the medications and how they are organized. Always remember to include non-prescription medications in the medication review. Take note of the number of medications, the frequency, and how many prescribers are involved. A long medication list with many prescribers is potentially unsafe and increases risk of adverse drug-drug interactions or side effects, so it is very important to review medications at every visit. Next is mentation. Here you want to address the cognitive and mental health of your patient and mitigate sensory impairment. Remember that sensory impairment affects how one processes information, which directly relates to cognition. The core issues of mentation in older adults is to prevent, identify and treat, and manage dementia, depression, and delirium. It is important when taking a history and examining the patient to establish an older adult's baseline cognitive status using cognitive testing, which you will learn about in detail in a later talk. Inquire if there have been any recent changes in cognition, confusion, or memory loss. Is there new or exacerbated anxiety or depression? Inquire about life changes that may affect mood, such as the loss of the spouse, or a transition to a different level of care that may impact the older adult's independence. Remember that these changes may change what matters to the older adult, and as been mentioned before, inquire about changes in hearing or vision. The last is mobility. For your patient, you want to optimize functional status and safety so they can do what matters. When taking a history, you want to determine the patient's baseline mobility and activity level. Again, there are various tests that can be done to establish a baseline, and you will learn about these in later presentations. But even if you are unable to perform any specific tests, taking a history can get you an idea of your patient's level of mobility. Ask what a typical day looks like in terms of mobility. Ask them what their goals are for mobility. Depending upon other diseases affecting functional status, a patient's goal may be able to walk around their house and transfer to the bed or to the toilet, but they are content to remain in their home with help from family for other needs. Always ask if there has been any recent falls, or do they have a fear of falling, which is in itself a fall risk and a potential source of anxiety and depression, which can affect mentation. Ask if they feel unsteady or unbalanced when they walk, and if they use an assistive device when walking. Always inquire about activities of daily living, ADLs, and instrumental activities of daily living, IADLs. Find out if they need help with these activities, and if they do, who helps them. Always consider their overall risk of falling and any medications that can potentially impact their mobility. Caring for older adults is complex. There is a fifth M, and that is multi-complexity. There are syndromes that are considered specific to the geriatric population, and they are listed here. You will be learning about these in detail in other lectures, but keep in mind that you must consider all of these when you are caring for an older adult and know how to address them. It truly takes a team to provide comprehensive care to an older adult. Physical and occupational therapists address preserving mobility and ability to do activities of daily living. Some physical therapists specialize in exercises and behavioral modification, which can ease urinary incontinence. Occupational therapists will do home visits, making recommendations for devices or modifications to enhance safety at home. Speech therapists address swallowing and feeding issues, speech issues, and also will do cognitive testing because this can affect both feeding and speech. Pharmacists can be tremendously helpful in helping you to determine appropriate prescribing, identifying potential drug-drug interactions or adverse side effects, and help you to choose a more appropriate medication that will align with what matters for your patients. Dentists are crucial to the overall health of older adults. Poor dentition can lead to difficulty eating, as well as risk for serious disease. Audiologists and optometrists can address and mitigate sensory impairment. All other subspecialty providers can address specific diseases. Nutritionists can evaluate diets and suggest diets that are in line with what matters for the patient. Keep in mind that the pleasure of eating greatly impacts the quality of life, and the patient may choose a diet that may not be the best for disease management. For example, a patient with heart failure may find a low-sodium diet to be tasteless. They may be losing weight and not deriving much pleasure from eating. They may choose to eat a regular diet to maintain weight and avoid frailty. A nutritionist can help the patient make reasonable choices while minimizing risk of a heart failure exacerbation. Spiritual providers should be enlisted if in line with patients' preferences. Last, but probably the most important members of the team are family members, who are often the first-line support and can fill in gaps in history if the patient is unable to do so, particularly for those with dementia. I hope by the end of this course you will have gained an appreciation for the complexities and rewards of caring for these wonderful people. I invite you to watch this video and get an idea of why I love my job.
Do I feel my age? Not really.
I know I'm old in numbers, but otherwise I feel fine.
The thing that bothers me is that my kids are 60 years old. I'm staying young and they're getting old.
You look in the mirror and you say, oh my God, what happened to that woman?
We're old ladies, let's face it. I said, you're gonna come into my room one day and I'm gonna have a beard like Yasser Arafat.
I can't see well, I can't walk well, and I have trouble with my hands.
Otherwise, she's perfect.
Otherwise, I'm all right.
It's a blessing. The older you get, the wiser you become.
Are you getting smarter?
Day by day.
For me, the best part of getting older is losing inhibitions.
I don't care what anybody
I don't
thinks.
care. I don't care either, to tell you the
It's
truth.
their problem, not mine.
You get away with stuff.
What you see is what you get.
That's it.
Take it or leave it. That's it. That's
Thank
the
you.
bottom line.
Don't bother me. I'll act silly,
You don't like it, keep on walking.
That's all. Don't
Go through the door
right.
and don't come back.
and I'll get away with it.
Keep on moving.
Keep on going and going and going.
Time to move on.
Tell that person not to come here anymore.
Being curious keeps your brain young.
Have a passion. Feed the passion. I'm still studying with a very great pianist, so we FaceTime.
I'm ready for you.
Okay. I wouldn't have been able to move here if I couldn't take my piano with me. It's the essential.
I mean, it's the way you look at things. Forget the age. Just go on every day and take advantage of every day. People that are in their 30s act older than I do.
I've learned to play fool.
Wonderful.
I think he thinks I'm crazy. Everybody who passes and sees me thinks I'm crazy.
Well, the only thing I have against her, she doesn't give me the money.
I am a die-hard Yankee fan. I love sports. Sports was my life.
You can still swim.
I'm coming swimming. I can show you my muscle. Not on the tape.
Not now.
Not now.
Not now.
I play chess. I think I'm one of the better players in here, so that's one of the reasons I go downtown, you know, because they got the killers down there, you know.
You meet women downtown?
Yeah.
You never told me that.
Well, there's women all over, so.
I think older people, some are very beautiful. And as long as I got a smile out of a woman, I was happy.
They allow overnight guests.
They do?
You didn't know that?
No.
Too bad.
Most of the men here are too old for me.
They wear their pants up to the neck.
Well, he can
You know,
always
the old-
lower it.
You know, the old men, they have their pants up. I'm telling you, she's hysterical.
Now my goal is to be happy.
You know, I don't have to take care of children or husband. I've lost him. And so now I can decide, what do I enjoy? What have I really, truly enjoyed?
And I would like to dye my hair purple. I would think it would be a blast. It's a joyful color and it's a royal color. And I am royalty.
There's no need to think that your life ends at 65 or 70. Life is very interesting at 95.
Getting old is out. Getting older is better.
I think that getting old is pretty good. I really do. It sounds crazy.
But thank God for me, I have my full brains. I have my full head. Not of hair, but my full head.
Something could flourish. I'm looking for it, really. If I find somebody, I'm not gonna let her go.
Well, some people think when you're old, that's it, you know, but they're stupid. I mean, they don't know. It's not too bad. Not too bad at all.
You better watch me go.